How you doing, Mr. Wall?
How you doing?
Okay. First, I want to thank you for coming in today. And I'm Lavisha. I'm an occupational therapy assistant. And I was referred to you through your doctor. Okay. Have you ever heard of occupational therapy, Mr. Wall?
No, I heard of a physical therapist, but never occupational therapist.
Okay, well, let me explain you a little bit about what occupational therapy do for a client. Basically, we like to help you do things that you enjoy doing so that you have a fulfilled life. And we also try to get you back to being as independent as possible.
Okay.
So do that sound like something that interests you?
Yeah, it sounds good.
Okay. Well, I pulled your file and I saw in there that you have a severe case of rheumatoid arthritis in both hands, and you've been put on prescription, but you're still having a lot of pain.
Yes.
Okay. Now, if I ask you, Mr. Wall, from the scale of 1 to 10, 10 being the most intense pain, where's your pain at now?
9, 10.
That's high. Okay. All right. Well, today basically what I'm going to do is do a interview, and I'm just going to ask you some basic questions about, what your name is and so forth, and then try to figure out what type of activities that you did in the past that you would like to be doing now, and also some different things that maybe that you even do for others.
Okay.
Okay. Does that sound okay?
Yeah.
Okay. Now let me explain before I get started, Mr. Wall, that this interview is strictly confidential, and pretty much it'll be what you tell me. And you also at any time can stop me or look at the notes to make sure that I'm portraying you in the best light.
Okay.
Okay. Now, how old are you, Mr. Wall?
45.
Okay. And your full name?
Corey L. Wall.
Okay. And do you want me to continue to call you Mr. Wall? Or?
No, you can call me Corey.
Okay, Corey. Okay. And again, I'm Lavisha. Okay. Now, are you married?
Yes.
Any kids?
No kids.
Okay. And are you working right now?
No. I've been out of work for about 2 weeks.
Okay. Now, are you trying to get back to work?
Yes.
Okay. What type of work did you do?
Setup operator on screw machines.
Okay. Did you use your hands?
All day.
Okay. And how many days a week did you work?
Pretty much 7 days.
Okay. Now let's get back to your job. You said that you use your hands a lot, so you operate different types of machines. Or
well, one machine, different process.
Okay.
Change tools, inserts. You make adjustments. You check parts.
Okay.
Write down notes from the parts you just checked.
Okay.
It's pretty much a rotating process. You do it one time, then you do it again, and you do it over and over.
So you do a lot of repetition.
Yeah.
Okay. Gotcha. Okay. Now, I noticed you said that you work pretty much when you was working 7 days a week.
Yeah.
Could you walk me through a typical day of activities that you do for a full day?
When I was working, I get up 4:30, 5 o'clock.
In the morning?
Yes.
Okay.
Try to go get dressed, wash, brush my teeth, brush my hair. Put on your shoes, socks and shoes, and leave and go to work. It's about an hour drive one way.
That's a long drive.
Yeah.
Okay. And you drive on your own? Or?
Yes.
Okay. Okay. So pretty much you wake up, wash, get ready, and drive to work.
Yeah.
Okay. Now, were you having any difficulties doing any of those activities when you was working?
With the way I am now, the arthritis, it's hard to kind of wash and get dressed because you can't. Your hands being so much pain,
okay.
it's kind of hard to do the things.
Okay. I noticed you said you wear a uniform or you don't wear a uniform?
Yeah, I wear uniforms.
Okay. Is it buttons?
Yes.
Okay. All right. Okay. Now, at home, do you play any type of roles like husband? Obviously, you do your
Yeah.
have
Well,
to do anything.
swap the cooking part out every now and then. But then, you know, you got the yard work, but I ain't been able to do that, you know, in a while. But pretty much sometimes I wash my clothes, and my wife wash my clothes. Well, pretty much we kind of swap out some of the chores every now and then.
Okay. All right. Now I heard you say a couple of things like getting dressed, washing, doing yard work, driving. Okay. So what I'm gonna do next, Corey, is get a little bit more specific, and I'm gonna go through some different activities, and I'm gonna name them as I go through them, so that you can rate them from the scale of 1 through 10, 10 being the most pain, 1 being the least pain. Okay, I'm gonna start off with self-care, personal care, which is like your hygiene, getting dressed, brushing teeth, eating. Where would you say you're at with that?
I would say 9, 10. The pain is there, but it's more or less aggravating when you can't perform normal procedures because of the pain, because of the arthritis.
Dressing, brushing teeth,
putting
on shoes. Okay, so a 9. All right. Now, is it easy for you to move like in and out of the bed, up and down the stairs, in and out of the car?
Getting out the bed ain't a problem. Getting dressed is the problem. First, getting in the truck to leave to go to work, sometimes it's aggravating trying to put the key in the thing.
Okay.
But it's more or less aggravating.
Now, when you're driving, you said it's aggravating. Do you feel any pain?
Yeah, some pain because I have to rotate after I hold the steering wheel. I'm going to say 15, 20 minutes with one hand. I have to go and try to hold it with the other hand because of the pain in the right hand. Okay. It's like you're going back and forth throughout the ride.
Okay. So from the scale of 1 to 10 with driving, your pain?
I'm going to say 10.
10 as well. That's high. Okay. Now, productivity, I heard you say that you work, and you say that you would like to get back to work?
Yes, I've been out of work about 2 weeks.
And you've been out for 2 weeks, and you work pretty much 7 days a week, okay? And are you going to continue when you go back to work, working 7 days?
Most likely. I've been there 20 years, and working pretty much 7 days, probably 90% of the time.
Okay, all right. Now, I heard you say that you was married. Now, with the household, do you do any of the cleaning, cooking? I heard you say you wash clothes sometimes.
Yeah, we try to. My wife does most of it. Every now and then, I'll try to cook something every now and then.
Okay.
But I try to help out when I can.
Okay. So is that important? Or?
It's important to the wife.
Okay. All right. So, is it any of those chores that you would like to be doing now better, or are you feeling?
Yeah, because I ain't been able to do as much because for the cooking part, yeah.
So cooking,
you can't hardly bend your hands enough to hold the spoons.
Okay.
And there's a lot of little small stuff. It's more or less aggravating than painful.
Okay. Now for leisure, do you do anything for like quiet recreation, like watching TV, listening to music, reading?
Yeah, I watch a good bit of TV, but now I ain't not watching it and dozing off because it's kind of hard to turn the remote sometimes, turn the channel, with the remote. So I end up dozing off and end up going to bed.
Okay. So when you're changing the channels or the remotes and stuff, how much pain are you?
I'm going to say about 8.
8, okay. All right. And as far as active recreation, do you have any hobbies or sports or
I used to do pretty good fishing.
Fishing, okay.
But I ain't been able to do that in a while either.
So you enjoy fishing?
Yeah.
Is that something that you would like to start back?
Oh, yeah.
Okay. Well, that's something we can help you with. Now, socialization, do you talk to your friends, family?
Yeah, since I've been out of work, they've been calling or texting to try to check on me and see how I was doing. But when they call, I can pretty much catch them and talk to them. But when they start doing all that texting, I can't text because my fingers be hurt, my hands be hurt.
So you don't text, but you can talk.
I can talk to them when they call.
You can hold the phone.
Yeah, but then they get aggravated too, and I tell them I'll talk to them later.
Okay. Well, that's the end of the activities. Well, Corey, what I see here, I pull out the 5 activities, and I'm just gonna call them out, and you can let me know if it's right or wrong. Hygiene, driving, getting back to work, cooking, and as a act of recreation, you said you would like to go back to fishing.
Yes.
So does that sound like some different some goals that you would like to be working in? Okay, so that's 5 goals, and what we'll do is rank most important to least, and then we'll work, on this list and create some different interventions so that we can reach these goals. Now you got hygiene, driving, work, cook, fishing. Which is the most important?
I would say hygiene because
Okay.
a man should be able to wash
All right.
his own self.
Okay. And then
I kind of need to get back to work
okay.
because I feel like I need to work.
Okay. And
But after that, how it fall?
you got driving, cooking, fishing.
Well, I'm gonna have to get back to driving because I got to get to work.
Okay.
The fishing can be the last thing.
Okay. Now let me ask you something. Do you have a good support net, like any family support
My
to
wife.
help you? Okay. All right. Okay. So. Okay. Got that. Okay. Well, I've got some different things that I see that you would like to work on, and what I could do is create an intervention plan, and then we can start working together maybe every other week on these different things. Does that sound good?
Sound like a winner.
Okay. Well, thank you again, Corey, and I'll see you in another week.
Thank you.